Did you know that by the time you finish watching this video, nearly 20 seniors will have been newly diagnosed with dementia? That's one person every 66 seconds. But here's the terrifying part. The real cause isn't just aging, but the very pills sitting in your medicine cabinet right now. You've likely been told these pills are safe, routine, even essential for your health. But growing research is raising serious alarms. In fact, 99% of seniors have no idea that at least one medication they take could shrink vital memory centers in the brain by more than 28% in less than a year. Imagine that, and it gets worse. The pharmaceutical industry has been aware of this risk for decades, yet billions are still made every year from drugs that may be silently accelerating memory loss and cognitive decline in older adults. A 2023 study in neurology and aging research even found just one class of these drugs increased dementia risk by 49% in seniors within only 2 years of use. In this video, we'll reveal the 9 most common medications that have been shown to speed up memory loss and even trigger dementia, often without seniors or their families realizing what's happening. We'll count them down from the ones that are often ignored to the most harmful, and we'll explain why they damage the brain, what the research says, and most importantly, the safer options you can discuss with your doctor. And trust me, you'll want to stay until the very end, because number 3 is a medication millions of people take for something that seems harmless, but it can actually shrink the very part of your brain that stores new memories. So, without any further delay, let's begin with number 9. Diphenhydramine, or Benadryl. Let's begin with one of the most overlooked but most common medications, diphenhydramine, best known as Benadryl. It's that little pink pill many seniors keep on hand for allergies, colds, or even to help them sleep. Because it's cheap, sold over the counter, and has been around for decades, most people assume it's harmless. But here's the truth. Inside your brain, Benadryl is doing more than making you drowsy. It belongs to a group of drugs called anticholinergics. These drugs block a vital chemical messenger called acetylcholine. Why does that matter? Because acetylcholine is what helps your brain form new memories, focus, and stay alert. And as we age, our brains naturally produce less of it. That means every bit we have is precious. When diphenhydramine blocks acetylcholine, the result can be devastating. Memory lapses, confusion, difficulty concentrating, changes that many families mistake for normal aging, but studies prove otherwise. A 2023 study in the Journal of Geriatric Cognitive Health found that seniors who used anticholinergic drugs like diphenhydramine had a 54% higher risk of developing dementia compared to those who didn't. So, what can you do? The first step is to avoid anything labeled PM, nighttime, or allergy relief if it contains diphenhydramine. These are often just Benadryl in disguise. If you need allergy relief, ask your doctor about newer non-sedating options like loratadine Claritin, which do not cross into the brain and are much safer for long-term use. Never assume that over-the-counter means safe. Sometimes, the everyday pills in your cabinet are the ones doing the most silent damage. Number 8. Proton pump inhibitors. Next is a class of drugs many seniors have been told they need for life. Proton pump inhibitors, or PP, is found in brands like Prilosec or Nexium. They're prescribed for acid reflux, GERD, or chronic heartburn, and once you start, it often feels impossible to stop because the symptoms return as soon as you quit. But what's rarely explained is how PP can harm your brain. By powerfully suppressing stomach acid, they also block the absorption of vitamin B12, magnesium, and calcium, nutrients your brain relies on to protect memory, regulate mood, and allow neurons to fire signals efficiently. Without them, your brain cells struggle to talk to each other, leading to brain fog, confusion, and memory lapses that mimic early dementia. The evidence is strong. A 2016 study in JAMA Neurology that followed over 73,000 seniors, aged 75 and older, found that regular PPI users had a 44% increased risk of developing dementia compared to non-users. Even more concerning, newer research shows that PPIs may increase amyloid beta plaque in the brain, toxic proteins strongly linked to Alzheimer's disease. So what are the options? If you're on a PPI, long-term, speak with your doctor about slowly tapering off, in some cases, switching to H2 blockers like famotidine Pepcid, may reduce symptoms with less impact on cognition. Natural approaches like chewing deglycerated licorice DGL can soothe the stomach lining without interfering with memory. Remember, acid reflux may feel like a stomach problem, but when treated improperly, it can turn into a brain problem. Number 7. Bladder control medications. For many seniors, bladder issues bring embarrassment and frustration. Medications like oxybutynin ditropin are often prescribed to help with urinary urgency or incontinence. On the surface, it feels like a solution to regain dignity. But here's the hidden danger. Oxybutynin also works by blocking acetylcholine. The very same chemical diphenhydramine interferes with, and unlike some weaker drugs in this category, oxybutynin crosses the blood-brain barrier icily, directly affecting the hippocampus, the brain's memory center. The damage can be profound. A 2019 study published in the BMJ found that seniors over 65 who took strong bladder control medications like oxybutynin for more than a year had a 49% higher risk of dementia. That's nearly 1 in 2. Many seniors describe feeling foggy, forgetting appointments, or losing track of conversations, but rarely connect these symptoms to their bladder medication. The truth is, what seems like normal aging may in fact be drug-induced memory decline. The good news, safer alternatives exist. A newer medication called Mirabeg works through a different pathway and has much less impact on cognition. Always ask your doctor if switching is possible, because bladder control should never come at the cost of your memory. Number 6. Statins. Statins are among the most prescribed drugs worldwide, especially for those over 60. Medications like simvastatin Zocor and atorvastatin Lipitor are designed to lower cholesterol and reduce heart attack and stroke risk. But here's something few realize. Cholesterol isn't just a heart issue, it's a brain necessity. The brain is made up of nearly 60% fat, and cholesterol is essential for building and maintaining the myelin sheath, the protective coating that helps nerve signals travel quickly and smoothly. When cholesterol levels are driven too low, the brain may not function properly. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 who had been on statins for more than 3 years had a 26% higher risk of mild cognitive impairment. Some even reported sudden memory gaps, forgetting names, losing track of familiar routes, or blanking on conversations. It's important to note that not all statins affect the brain equally. Pravastatin and rosuvastatin, Crestor, are less likely to cross into the brain and may pose less cognitive risk. If you've been on statins for years and notice increasing brain fog, it's worth a conversation with your doctor about alternatives or dose adjustments. Protecting your heart should never come at the expense of your memory. Number 5. Benzodiazepines. Next are the widely prescribed benzodiazepines. Medications like diazepam, Valium, lorazepam, Ativan, and alprazolam Xanax. They're given for anxiety, panic attacks, and sleep problems. At first, they feel like lifesavers. They calm racing thoughts, ease panic, and help with sleep. But here's the trap. Over time, benzodiazepines don't just calm the brain, they slow it down. They enhance GABA, the brain's calming chemical, but in doing so, they blunt learning memory and mental flexibility. The risks are staggering. A 2022 study in the BMJ followed more than 8,000 seniors and found that those who used benzodiazepines for longer than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk was even higher with long-acting drugs like diazepam, which linger in fatty tissues, including the brain. Patients often describe feeling like they're in a fog, disconnected from themselves, or emotionally flat. And when they try to stop, withdrawal can be brutal. Anxiety, sleeplessness, and agitation. If you're on a benzodiazepine, never stop suddenly. It can be dangerous. Instead, taper carefully under medical supervision. Alternatives like buspirone for anxiety or cognitive behavioral therapy, CBT for insomnia, can provide relief without robbing the brain of its sharpness. Number 4. Amitriptyline. At number 4 is amitriptyline, an older antidepressant still commonly prescribed for sleep, chronic pain, or even migraines. It may seem versatile, but it comes with a hidden cost. It's one of the most powerful anticholinergic drugs still in use today. That means it blocks acetylcholine so strongly that memory loss and cognitive impairment aren't just possible. They're expected with long-term use. A massive study in JAMA Internal Medicine in 2015 tracked more than 3,400 older adults. Those who took high cumulative doses of anticholinergic medications like amitriptyline had a 54% greater risk of dementia. The scary part is, many seniors are never warned. They take it for sleep or nerve pain, and years later begin experiencing word-finding problems, short-term memory loss, or foggy concentration, chalking it up to aging, when in reality, the drug is silently eroding brain function. Safer alternatives exist. For nerve pain, duloxetine or gabapentin. For sleep, melatonin or low-dose doxapan. And for mood, newer antidepressants like sertraline Zoloft or escitalopram Lexapro. Number 3, paroxetine. Here's the shocking one. Paroxetine or Paxil is a widely prescribed antidepressant in the SSRI family. Most SSRIs are considered safe for seniors. But Paxil is different. It has strong anticholinergic properties, just like the older, riskier drugs. A 2021 review in Frontiers in Psychiatry found that seniors on paroxetine showed measurable declines in short-term memory and attention within the first 12 months. They were also 30% more likely to develop early cognitive impairment compared to those on other antidepressants. The irony: Paxil is often prescribed to stabilize mood, yet it slowly undermines mental clarity and emotional stability. That's why the American Geriatric Society lists paroxetine on its beers. Criteria: drugs considered inappropriate for older adults. Safer choices include sertraline or escitalopram, which support mood without the same cognitive risks. Number 2, antipsychotics. This one is alarming. Antipsychotics like quetiapine, risperidone, and olanzapine were developed for schizophrenia and bipolar disorder. Yet today, they're often prescribed off-label to seniors for sleep, agitation, or confusion. The consequences are devastating. A 2022 study in The Lancet, Healthy Longevity, followed more than 25,000 seniors and found that those prescribed antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within 12 months. These drugs suppress dopamine, the brain's motivation and memory chemical. The result? Seniors often appear flat, sedated, or like a shadow of themselves. Families watch their loved ones fade, not realizing the cause is chemical, not natural aging. Unless absolutely necessary, these drugs should be avoided in seniors. Behavioral changes are often better managed through routine, reduced stress, and non-drug approaches. Number 1, anticholinergic polypharmacy. You may have been expecting one single worst pill to top this list, but the truth is even more concerning. The biggest risk isn't one drug at all. It's the silent, creeping effect of combining multiple medications that all block acetylcholine at the same time. This is called anticholinergic polypharmacy. Here's what that means in real life. A senior takes diphenhydramine at night for sleep, then uses oxybutynin during the day for bladder issues, and later adds amitriptyline for nerve pain. Each drug alone might cause some brain fog, but together they pile up, creating a toxic burden that overwhelms the brain's ability to function. And the numbers are chilling. In 2022, researchers publishing in Age and Aging tracked over 280,000 older adults. They found that seniors with the highest anticholinergic burden had a 120% higher risk of developing dementia within 10 years. That's more than double the risk compared to those not exposed. The tragedy is that most seniors don't even realize this is happening. They assume these medications are separate and harmless. But in reality, the combined effect is quietly starving the brain of acetylcholine, a messenger it desperately needs. When acetylcholine is blocked from multiple angles, the brain doesn't just slow down, it begins to atrophy. Neurons weaken from underuse, synapses shrink, and the brain slips into a state that looks identical to Alzheimer's disease. But here's the hopeful part. Unlike true Alzheimer's, drug-induced dementia can often be reversed when the anticholinergic burden is reduced by deprescribing unnecessary medications, switching to safer alternatives, and working closely with a physician. Seniors often regain clarity, focus, and energy within weeks or months. Families describe it as getting their loved one back. That's why the single most powerful step you can take today is this. Ask your doctor or pharmacist to review every single medication you take. Prescriptions, over-the-counter drugs, even supplements. Many professionals now use anticholinergic burden calculators to measure your total risk. Once identified, small changes can make a massive difference for your memory and independence. Polypharmacy is not inevitable, it's preventable. And recognizing it could be the most important thing you ever do to protect your brain. Now that you know the 9 most common medications that can silently trigger dementia, the next step is yours. Don't wait until memory loss shows up and feels irreversible. Because in many cases, it isn't. A simple medication review with your doctor could be the turning point that protects your brain and restores your clarity. Here's what I'd love for you to do today. First, take a moment to look at the medicines you or your loved one are currently taking. Second, ask your doctor or pharmacist about safer alternatives. And third, share your experience in the comments. Your story could help another senior realize the connection and take action before it's too late. At Senior Lifeline, our mission is simple: to give you the knowledge to stay strong, sharp, and independent for as many years as possible. That's why we bring you clear science-backed videos every week, because you deserve answers, not confusion. If this video helped you, please give it a like and share it with someone you care about. And don't forget to subscribe and turn on the notification bell so you never miss our new releases. Most importantly, don't stop here. If you want to protect your health even further, watch one of the videos appearing on your screen right now. Each one is packed with simple steps to strengthen your brain, rebuild your body, and live the vibrant life you deserve after 60. Thank you for trusting us with your health. We'll see you in the next video.